Cancer. The very word can instill fear and uncertainty, shaking the foundation of our lives. It's a complex group of diseases, but understanding the basics can empower us to face it with knowledge and strength. Cancer arises when cells in our body begin to grow uncontrollably, forming a mass called a tumor, which can disrupt normal bodily functions. These abnormal cells can invade nearby tissues and even spread to other parts of the body, a process known as metastasis, making the disease more challenging to treat. The impact of cancer is profound, affecting millions worldwide and creating a ripple effect that touches families, communities, and healthcare systems. It's a leading cause of death, touching countless lives and families. Knowledge is power, and with it, we can make informed decisions. By understanding the different types of cancer, their causes, and how they are diagnosed, we can take proactive steps towards prevention, early detection, and effective treatment, improving outcomes and quality of life. Let's demystify this complex disease and shed light on the path toward a healthier future, where hope and resilience prevail. Cancer is not a single disease. It's an umbrella term encompassing over 100 different types. Each type is classified based on the cell type it originates from. Some of the most common types include carcinoma. This type originates in the epithelial tissues, which form the lining of organs and surfaces like the skin, lungs, breasts, and prostate. Sarcoma. This type develops in connective tissues like bones, muscles, cartilage, and blood vessels. Lymphoma and leukemia. These cancers affect the lymphatic system and blood-forming tissues, impacting the body's immune response. Central nervous system cancers. These cancers originate in the brain and spinal cord. Understanding the specific type of cancer is crucial for determining the best course of treatment. The causes of cancer are multifaceted, often involving a complex interplay of genetic and environmental factors. Genetics inherited gene mutations can increase an individual's susceptibility to certain types of cancer. However, it's important to note that inheriting a faulty gene doesn't guarantee cancer development. It simply elevates the risk. Lifestyle. Our daily habits significantly influence cancer risk. Smoking, excessive alcohol consumption, unhealthy diet, lack of physical activity, and prolonged exposure to ultraviolet radiation are all established risk factors. Environmental factors. Exposure to certain chemicals, pollutants, and radiation can also contribute to cancer development. While some risk factors like genetics are beyond our control, modifying lifestyle choices can significantly reduce the risk of developing many types of cancer. Cancer is essentially a disease of uncontrolled cell growth. Normally, cells have a specific life cycle. They grow, divide, and die in a regulated manner. Cancer disrupts this order. Cancerous cells ignore these signals and continue to divide uncontrollably, even when new cells are not needed. This uncontrolled growth leads to the formation of a mass of abnormal cells, known as a tumor. Tumors can be benign or malignant. Benign tumors grow slowly, are usually localized, and don't spread to other parts of the body. Malignant tumors, on the other hand, are cancerous. They can invade surrounding tissues and spread to distant sites through the bloodstream or lymphatic system. Understanding this process helps us appreciate the importance of early detection and treatment. Cancer can manifest in myriad ways, and symptoms often depend on the type, location, and stage of the disease. Recognizing these symptoms early can be crucial for timely diagnosis and treatment. However, some common warning signs warrant attention. Unexplained weight loss. This is one of the most noticeable symptoms. Sudden and unintentional weight loss, especially if significant, can be an early indicator of several cancer types. Persistent fatigue. This is another symptom that should not be ignored. Feeling constantly tired and lacking energy even after adequate rest can be a red flag. Pain. Persistent and unexplained pain is a common symptom. Persistent pain, particularly in specific areas, can signal the presence of a tumor. Skin changes. These changes can be subtle or very noticeable. Any unusual changes in skin color, texture, or the appearance of new moles or growths should be checked by a doctor. Changes in bowel or bladder habits. These can be significant indicators. Persistent diarrhea, constipation, blood in the stool, or changes in urinary frequency or urgency can be warning signs. These symptoms should be taken seriously. It's important to note that these symptoms can also indicate other health conditions. Therefore, they should not be ignored. It's crucial to remember that these symptoms can also indicate other health conditions. Consulting a healthcare professional is essential for a proper diagnosis. However, it's always best to consult a doctor for a proper diagnosis. Early detection can make a significant difference in treatment outcomes. While some symptoms are general, others are more specific to certain types of cancer. Breast cancer, lumps in the breast or underarm, changes in breast size or shape, nipple discharge, or skin changes like dimpling or redness are potential signs. Lung cancer, persistent cough, chest pain, shortness of breath, wheezing, coughing up blood, or hoarseness can indicate lung cancer. Prostate cancer, frequent urination, especially at night, difficulty starting or stopping urination, weak or interrupted urine flow, pain or burning during urination, and blood in the urine or semen can be signs of prostate cancer. It's important to be aware of these specific symptoms and report them to a healthcare professional promptly. Early detection is key to successful treatment. Breast cancer, a leading cancer type in women, arises from the uncontrolled growth of cells in the breast tissue. It often begins in the milk ducts or lobules, the glands that produce milk. While the exact causes are complex, risk factors include gender. Being female significantly increases the risk. Age, the risk increases with age. Family history, having a close relative with breast cancer elevates the risk. Genetic mutations, inherited mutations in certain genes like BRCA1 and BRCA2 can significantly increase susceptibility. Early menstruation or late menopause. Prolonged exposure to estrogen is linked to a higher risk. Early detection through regular mammograms and self-examinations is crucial for improving treatment outcomes. Lung cancer, a leading cause of cancer deaths worldwide, often develops silently in the early stages. It originates in the lungs, the organs responsible for breathing. Smoking is the primary risk factor, accounting for the majority of cases. Other risk factors include exposure to secondhand smoke. Inhaling smoke from others' cigarettes also increases the risk. Exposure to radon, this radioactive gas found in some homes, is a leading cause of lung cancer in non-smokers. Exposure to asbestos and other carcinogens, occupational exposure to certain chemicals and substances can elevate the risk. Early detection is challenging as symptoms often appear late. However, persistent cough, shortness of breath, and chest pain warrant medical attention. Prostate cancer, a common cancer in men, affects the prostate gland, a small walnut-shaped gland that produces seminal fluid. While the exact causes are unclear, risk factors include age. The risk increases significantly after age 50. Race, African American men have a higher risk. Family history, having a father or brother with prostate cancer increases the risk. Early detection through regular prostate-specific antigen, or PSA, blood tests and digital rectal exams can improve treatment outcomes. Diagnosing cancer involves a multi-pronged approach, utilizing various tests and procedures to confirm the presence of cancerous cells and determine the type and stage of the disease. This comprehensive process is essential to ensure that the diagnosis is accurate and that the most effective treatment plan can be developed for the patient. Physical examination. A thorough physical exam helps assess overall health and identify any unusual lumps, swelling, or other abnormalities. During this exam, doctors may also ask about the patient's medical history and any symptoms they have been experiencing, which can provide important clues about the presence of cancer. Imaging tests, techniques like X-rays, Connecticut scans, MRI scans, PET scans, and ultrasounds provide detailed images of internal organs and tissues, helping to detect tumors and assess their size and location. These imaging tests are crucial for visualizing the extent of the disease and planning the appropriate surgical or therapeutic interventions. Laboratory tests, blood tests, urine tests, and other laboratory analyses can detect tumor markers, substances released by cancer cells, or other abnormalities indicative of cancer. These tests can also help monitor the effectiveness of treatment and detect any recurrence of the disease. Biopsy. This procedure involves removing a small sample of suspicious tissue for microscopic examination by a pathologist to confirm the presence of cancer cells and determine the type and grade of the tumor. Biopsies are often considered the gold standard for cancer diagnosis, providing definitive evidence of the disease. Accurate diagnosis is crucial for guiding treatment decisions and determining the best course of action for each patient. With a precise diagnosis, Healthcare providers can tailor treatment plans to the individual needs of the patient, improving the chances of successful outcomes and enhancing the quality of life for those affected by cancer. Cancer, a formidable foe, continues to pose significant challenges to global health. While we've made significant strides in understanding its complexities, the fight is far from over. Early detection remains our most potent weapon. Regular screenings, healthy lifestyle choices, and awareness of potential warning signs can significantly improve outcomes. Ongoing research continues to unravel the mysteries of cancer, paving the way for innovative treatments, targeted therapies, and ultimately a cure. By supporting cancer research and promoting awareness, we can collectively contribute to a future free from this devastating disease.